is quality wound care and how are we going to measure it? Let's take a few examples of patients and walk through this. This is a 30-year-old male who has a 1-year history of a small non-healing ulcer on the top of his toe after dropping something on it at work. He was followed for a year at another wound center in my city using a variety of topical products. But a careful history reveals that he has claudication when walking from one end of the machine shop to another. And it turns out that non-invasive studies showed that he had very severe peripheral vascular disease. Transcutaneous oximetry on his foot was only 4 millimeters of mercury, and he had a monophasic waveform on PVR. He underwent an MRI which showed that he had osteomyelitis of the great toe, and he actually required peripheral bypass surgery. This is another patient, 32 years old, with diabetic peripheral neuropathy and a non-healing plantar foot wound which failed to respond to many topical interventions over 12 months, including bilaminate skin application. I placed her in a total contact cast, and she healed over an 8-week period with this cast. The third patient we'll discuss is a patient who's 54 years old with a 10-year history of bilateral circumferential leg ulcers. He's never been provided with compression. He thinks he might have had blood clots in the past, but that's never been investigated.